Guys, am I audible? Yes, yes. Thank you, sir. Then my topic for today's class will be fundus fluorescent angiography. Coming to the introduction scope, the technique of fundus fluorescent angiography is mainly used to assess the the vascular structure of the retina and the choroid using a dye which has a fluorescent property called as fluorescent, and this is used to identify the vascular pathology and assessment of the vascularity of the retina. Now we'll be seeing about the physiology and also some imaging and some of the clinical decisions that that we can take using FFA. So coming to the principle, it is based on the principle called as fluorescence. We have a dye called, the hero is the dye, that is the fluorescent, which has a property of fluorescence, which is nothing but when we excite the dye, the particles absorb the light and go to the higher energy state, and while coming back, the extra energy is emitted as a different light. So excitation light will be, in case of fluorescent dye, will be blue, that is which belongs to which is around 465 to 490 nanometers, and the emission will be in yellow green spectrum, that is 520 to 530 nanometers. The fluorescent property, barrier and excitation filters play a very important role, and it is also used for choroidal and retinal circulation differentiations. Coming to the pharmacokinetics of fluorescent dye, it is highly plasma bound. That is how we can visualize the retinal vasculature, and the distribution of the dye happens between vascular and extracellular compartments in the retina. The peak ocular circulation occurs in 7 to 15 seconds, and it is excreted by renal system, and the half-life of dye is about 23 minutes. The excretion makes the urine turn bright yellow. So coming to the technique and equipment, it is used, main instruments that are used are fundus camera, then wide field and ultra wide field system to visualize, and data storage and image analysis systems. And coming to detailed phases, we have 6 phases. That is choroidal flush, that takes place in the first 10 to 12 seconds, and arterial phase, arteriovenous or capillary phase, venous phase, late venous phase, and recirculation phase. Coming, there are mainly three patterns, that is hyperfluorescence. In hyperfluorescence, we have leakage, staining, pooling, window defect, and autofluorescence. And in case of hypofluorescence pattern, we have block fluorescence, filling defect, delayed choroidal filling, capillary dropout, hypoperfusion, and we can, by correlating, we can take decisions based for the diseases. So coming to the role of FFA in diabetic retinopathy is identification of neovascularization, differentiating between neovascularization and IRMAS. So there are other retinal vascular lesions like CRVO, BRVO, and arterial occlusions that we can identify using FFA, and also macular and choroidal disorders like CSCR, in which FFA plays a crucial role. We have certain artifacts which can be there, and I have a short quiz. If some of the students can identify this.
Quiz
It depends on. It decides your attendance today. Yes, sorry. Yes. So this is an artifact which is called as crescent, yellow crescent, which occurs due to improper access between the camera image capturing and the patient, and this is due to bright flashlight that happens. Yes, thank you.
Thank you, Shankar. That was a wonderful lecture. Yes, any questions?
A couple of questions. Yeah. What quantity and what percentage of the dye will we use?
Sir, there are 3 concentrations that is more commonly used. If it is 25%, we use 3 ml, and if it is 10%, we use 5 ml, and if it is 5%, we use 10 ml of the
20%, 3 ml?
25%.
20%.
20%.
And can we use a dye to drink and do a angiography?
Sir,
or it is only by intravenous use?
Sir, intravenous will be better, sir, because the absorption will be better. Oral.
There are mechanisms of oral fluorescence also.
what is the preparation you require? Is there any side effect? Is there any emergency situation?
Yes, ma'am. The higher the concentration, because it is iodine based, there is always history of allergy, and the most common is vomiting. Sorry, vomiting, nausea.
Iodine based.
Iodine based. Oh, sorry. Fluorescence. And vomiting, nausea, hitch, and it is prevented. It is preferred. It is avoided in chronic renal disease patients. It's a 5%, 10%, 5 ml. 10% 5 ml is the most commonly used. Yes, we are using 10% and 5 ml.
अखंड ज्योति में क्या यूज
Yes,
होता है बताओ?
10% of 5 ml of fluorescence. Yes, fine.
ठीक है, थैंक यू टीचर.